Welcome to the University of Washington Tracheotomy Care Training video module on how to perform a tracheotomy change. By the end of this video, we anticipate you will be able to explain the indications and contraindications of tracheotomy change, describe the steps necessary to prepare for a tracheotomy change procedure, demonstrate the tracheotomy change procedure, list 3 ways to ensure the trach is properly positioned. This module will describe changing an entire tracheotomy appliance and not just changing an inner cannula. For more information about how to change the inner cannula, please see the module entitled How to Change an Inner Cannula of a Trach. A trach tube is usually routinely changed every 1 to 3 months to enable placement of a fresh, clean trach tube through an established tract. Otherwise, tracheotomy appliance changes are performed when a different type of tracheotomy tube is needed, for example, a larger one or a smaller one, or a change from a cuffed tube to an uncuffed tube. Tracheotomy change can typically be performed at the bedside as long as the tracheotomy tract created at the time of surgery is well healed. This is felt to have occurred by about 5 to 7 days after the initial tracheotomy procedure. In a situation where the procedure is expected to be difficult or particularly risky for the patient, this may occur if the patient is obese or if the patient has had a difficult trach change in the past, the procedure may be performed in a physician's office or even in the operating room with better equipment and experienced assistants. The most important step in changing a trach is getting all the equipment ready ahead of time. If you are changing your own trach, make sure you have a good mirror and good lighting, and all of your supplies within reach on a stable surface. Although it is very important to be as clean as possible, this is not a sterile procedure. Supplies you will need are mirror and lighting, new trach ties, clean dressing, gloves, suction available, tissue or gauze, and lubrication. First, wash or sanitize your hands. You may want to put on gloves. Arrange all of your supplies on your table. Open up the new trach box and assemble the trach so it is ready to go. Place the ties on the flange, place the introducer into the trach tube, and keep the inner cannula handy. If your trach has a cuff, make sure the cuff is completely deflated before insertion. Dip the end of your trach tube in the lubrication. Now you are ready for the change. If you have a cuffed trach, make sure to remove all the air from the balloon. Undo the trach ties and remove the trach tube completely. You can take a moment to clean your skin and also inspect the trach site. Then, replace the new trach in the stoma following the curve of the stoma. Secure the trach straps. Replace the trach dressing. Make sure that the patient is comfortable and breathing easily. Initially, the patient may cough quite a bit, but this should settle quickly. Reinflate the cuff if necessary. Remember, when removing and inserting the trach tube, that you need to follow the curvature of the trach tract. When inserting, the trach tube will curve in and down as shown in this model. In this module, we describe the procedure for how to change a tracheotomy appliance.